Barry Eisenberg, director of the Michael S. Gordon Center for Research in Medical Education at the University of Miami, was invited in part by Platinum sponsor Laerdal to present on achieving and demonstrating optimal value from simulation in healthcare. This was perhaps one of the most empowering presentations I have ever seen from one of medical simulation's leading researchers, because Barry shared the incredible difficulty of replicating successful training methods gleaned from research papers which are limited in word count. Here, Barry recalls how he first learned about assumptions of implementation, which led to failed outputs for simulation colleagues attempting to duplicate his team's performance mastery-based learning research.
A couple of colleagues and I went to their Korean Society for Simulation in Healthcare, their first meeting, and held a faculty development workshop. And I was asked by the president if I could meet in a small group with some of the researchers who were trying to apply what we were sending out to them. And he sat down and he said, well, Professor Eisenberg, we respect the work you're doing and we followed it, both your work and Professor McGady's, but we're just not getting the same results. And I said, well, what do you mean? And they said, well, we're not getting this transfer of learning from the simulation center to the clinical environment. It's just not, it's not happening. So I said, well, tell me something about your instructor, because I knew they were using the same mannequins we were using, they were using the same curriculum, they had translated the same outcome measures, so a lot of that was standardized. Well, tell me something about your instructors, or who are they? And he said, well, they're the clinical experts. They're emergency physicians and critical care physicians who are providing the instructions. They're considered experts in their field. And I said, well, that's good. Well, tell me something about what experience and expertise do they have in teaching and instruction? And there were just blank stares, and they said, well, we have experience, we don't have expertise in teaching or instruction. We do this whenever we have time to do it. And I said, well, don't you think that's important? And they said, yes, and they start pulling out all these articles. It doesn't say anywhere in these articles anything about the level of teaching or instruction your teacher should have before they're teaching. I said, well, you make a good point. I said, well, tell me, when do these sessions take place? Because it seems like you don't have a lot of protected time. It seems like you're busy. And they said, well, on average, our sessions would occur between 8 p.m. in the evening and 10 p.m. during the week, and on Saturdays. I said, well, why did you choose those times? They said, well, we didn't choose those times. That's when we get off shift. That's when we have time to teach. And on Saturdays, that's the only free day we have during the week. And I said, well, how do you feel about that? And they said, well, we're pretty tired when we have to teach. I said, what about your students? And they said, well, our students are pretty tired. And I said, so if you had to choose a time that was the most optimal time to train your learners, what would it be? And they said, well, probably 8 or 9 in the morning. And I said, well, you go to those studies, that's usually when they conducted the training in these studies that we reviewed. Again, they pulled them out, looked through them, and they said, well, it doesn't say anything in here about the timing of these. And so it made me step back and say there's a lot of assumptions that we make when we're carrying out research that we take for granted, that when we go to try to generalize to other areas, we're not thinking about the realities of their world. And so it made me pause and say, well, yeah, we got these results. We were able to identify these results, but really why and how did it happen?
Visiting multiple sessions throughout the conference, I could easily see that there was an energy to ASPiH presenters similar to that of SimGhost events, one which is full of excitement and passion for the use of medical simulation. Upstairs, medical simulation users from around the UK shared their success stories, while downstairs, Laerdal provided a workshop on SimPad use. At the same time, Dr. Baxendale and Andy Buttery taught a debrief workshop which used the famous breakfast scene from Kramer vs. Kramer as the recorded scenario.
The debrief of the debrief is a debrief of a real event that had to happen and had to happen then. So it's got a lot more, I think, in common with the debrief in clinical practice, which is going to be something that you enter into partway through, are engaged in yourself, and then probably while the action is still continuing in some sense, you're asked to debrief that team.
To be honest, I can't fit in here all of the wonderful content and connections I made while attending ASPiH 2013. I would highly recommend this meeting for simulation champions within the UK or the greater European Union who are looking to better connect with the others engaging with this innovative field. Luckily, Dr. Baxendale announced at the meeting a new journal which will provide expanded opportunities for literature within the global simulation community.
At the conference, we were very proud to announce the launch of a new journal, which is the BMJ Simulation and Technology Enhanced Learning, which is a journal which will be integral to our community, and I think hopefully to the much wider international community, about offering another portal for publication, and which I think will offer some different options from that which are currently available, such that it will broaden the literature and it will broaden access to innovation and to a network of people who are innovators.
Learn more about this empowering organization and the November 2014 event by visiting aspie.org.uk. Stay tuned for more interviews from ASPiH 2013 on healthysimulation.com.